Recently, one of my clients who wanted to start my healthy aging blueprint program told me how she also wanted to start the anti-aging program that Bryan Johnson was following. Since I wasn't completely aware about it, I decided to check it out. And
skin is the largest organ of our bodies. As a kid, I kind of destroyed mine. I was in the sun all the time, no sunscreen, and now I'm in my 40s, I'm paying the price. I'm gonna show you 3 things today. I'm gonna start with the creams, then I'm gonna show you lasers or devices, and then I'm gonna tell you what you should do on a daily basis.
do I approve it? What do I feel about it? Is it extreme? Is it brilliant? Is it unreasonable? Let's find out. Apparently, Bryan Johnson is the world's most measured man. Through his project Blueprint, Mr. Johnson is believed to have achieved metabolic health equal to the top 1.5% of 18-year-olds. His inflammation is 66% lower than the average 10-year-old, and he has managed to reduce his speed of aging by an equivalent of 31 years. Bryan freely shares his protocols and data publicly for everyone to use, which I personally admire, since you need courage to actually use yourself kind of a guinea pig for the benefit of science and the community as a whole. But before we discuss Bryan's routine in detail, I wanted to say a quick hi. I'm Dr. Sanober Doctor, fondly known as Mrs. Doctor. I'm a board-certified dermatologist practicing integrative and holistic dermatology. I'm a strong believer in knowing the what, when, and how. And the key to achieving optimal health needs to be an all-round approach. That is what I preach, believe in, and strongly advocate. Let's see what Mr. Johnson is doing for his anti-aging skincare routine. So without any further ado, let's begin.
I wake up, I wash my face with CeraVe. It's got some salicylic acid, which is like just enough to keep my face blemish free.
He uses a basic salicylic acid cleanser from CeraVe, originally derived from the bark of plants such as willow and meadowsweet. Salicylic acid has long been used as a remedy for various skin concerns. Now essentially, salicylic acid is a beta-hydroxy acid that gently exfoliates the skin. It is a non-comedogenic ingredient, which means it has the ability to unclog pores, and thus it is very suitable for those having blackheads or acne-prone skin. Now Bryan is on a medication that can cause acne as a side effect, and probably that is why this is part of his routine. But do you need to use it? Now salicylic acid per se does not confer any specific anti-aging properties. So you can use salicylic acid for daily exfoliation if you have rough and bumpy skin, or if you have oily and acne prone skin. But you should be a little careful if you have dry and sensitive skin.
I also microdose Accutane, so I currently take 2 pills a week, each one's 40 milligrams.
Now next in Bryan's routine, he mentions that he microdoses on Accutane. Accutane is the brand name for the generic term Isotretinoin, not tretinoin that you apply to your skin, but this is the oral form Isotretinoin. He takes 2 tablets of 40 milligrams per week. Now Isotretinoin is essentially used for the treatment of acne, specifically nodular cystic acne, which is a severe form of acne, and other skin conditions like hidradenitis suppurativa, which is where you'll get these very painful boils in your armpit or the folds. So should you microdose on Isotretinoin for anti-aging benefits? I personally don't think so. There are very few studies that actually show any benefit greater than what you would achieve by applying retinoic acid over your face. Retinol, what you get over the counter, is the weaker version, and even that has been found to improve collagen production and help with fine lines. There is a small clinical trial that studied 60 patients. They divided the patients into 2 groups. Both the groups were given additional modalities of skin rejuvenation, but only one group was given oral Isotretinoin. Now they did find statistical difference in the group that was given Isotretinoin in terms of improvement in wrinkles, thickness and color of the skin, size of pores, skin elasticity, tone, and reduction in any pigmented lesions. But what you also need to know is that taking oral Isotretinoin has its own set of side effects. We are not only speaking about dryness of the mouth and eyes and dry chapped lips, but its long-term use also has the potential to harm and disrupt your liver and lipid profiles. It can lead to something known as pseudotumor cerebri, and there are many other things that you need to be careful about. Remember, Bryan is being constantly monitored, but I don't think it is sustainable for the average human to consider taking it. Also, this is especially important for ladies. Isotretinoin is a known teratogen. This means it should not be taken if you are pregnant or you're wishing to have babies. We literally have to take a gazillion consents and pregnancy tests before we can actually prescribe it. Okay, not those many, just 2, but still. You understand the importance, right? Bryan's main reason for taking it is because he's trying to take care of acne that is caused as a side effect of one of the drugs he's taking, and that is Rapamycin. Rapamycin. Now before we discuss that, let's see what is the next thing he has included in his routine.
I just applied this Adipeau cream. We've been trying this now for 3 weeks. Like we do with every cream, we're motivated to see, does this work by the markers we can measure? So this is basically feeding fat cells in my face because I'm trying to rejuvenate the volume in my face.
Now apparently this cream has a proprietary patent pending combination of natural ingredients that has the power to apparently rejuvenate skin fat cells. Do you believe this? Take a look at the ingredient list and you see nothing that can potentially back that claim. But you know what can add nourishment to your skin and fat cells? Eating good quality butter, lard, cheese and ghee. This is not it, but there is so much more that you can do. I think it is definitely going to Bryan's skincare graveyard. Talking of which, what I also wanted to share with Bryan and with everyone else, you cannot really try a cream or any topical for that matter for a few days and decide whether it is going to or not going to work for you. You need to at least, and I say at least, use the topical for 3 to 4 weeks. According to me, at least for 3 months before you can decide that is going to do no good. One of the complaints that we as dermatologists have, and ask any dermatologist for that matter, especially when the patient tells us that they tried this and that but it did not work, is not only what you tried but how long did you try it for to see any visible changes over your skin, especially when we're talking about anti-aging concerns like taking care of pigmentation or wrinkles. It is going to take time. Even when we are talking about creating and maintaining a healthy skin barrier, the changes that any topical remedy will take will be slightly long. And this is because our skin cycles that way. It takes 28 days for the new cells to grow, mature, divide and reach the surface. And then another 14 to 28 days for it to shed off before you can actually see the new skin cells that have been formed. Let alone taking care of collagen production, reducing anti-inflammatory cells. There are so many other things that come into play. So that is something that I want you to keep in mind.
Creams don't move the needle.
This is true and false. I don't believe that only applying creams topically is the answer to achieving healthy skin and reversing the damage, but I also know and have seen the power of certain topical ingredients like retinoic acid or niacinamide and so on.
I wear sunscreen because the sun causes damage. It ages the skin and causing aging damage. So I try to spend my time in the sun in the early mornings or in the evenings when the UV index is low. Otherwise, I stay out of the sun, but when I am in the sun, I do have sunscreen on.
This is absolutely true and a must. You need to protect yourself from excessive ultraviolet light exposure. Now, I am a firm believer of safe sun exposure, but you must have heard me talk about this again and again on this channel, that you need to protect yourself from the strong rays of the sun if you're going to be out for more than 5 to 10 minutes. Bryan uses the 𝐿TA sunscreen. I personally feel there are much better ones that are available out there that not only do a better job, but they are also more economical. The 𝐿TA sunscreen has things like hyaluronic acid and niacinamide, which you don't actually need in a sunscreen. Instead, I would opt for a pure physical sunscreen. Now, in all honesty, they might make you look like a white ghost, but if you're like Bryan who wants to take sun protection seriously and help your skin heal from all the damage that it was previously subjected to, then use a physical sunscreen, wear a hat, protective clothing, or walk with an umbrella as Bryan shared. Now let's talk a little bit about Rapamycin. Since Bryan mentioned he was taking it, I wanted to share a few pointers since I know many in the biohacking community are taking it or are considering taking it. So if you plan to take Rapamycin for anti-aging benefits, first, always consult your doctor. You must do this because you need an experienced mind to help you along the journey. When it comes to taking it, Rapamycin advocates shared taking it following the example of the tortoise instead of the hare in the hare and tortoise race. So you start slow, something like 1 milligram every 2 weeks and work your way up. But remember, Rapamycin is an immunosuppressive. It was originally FDA approved to prevent rejection post-kidney transplants. So basically, it's going to depress your immune system and make you more susceptible, make you more likely to catch infections. It can cause reactivation of previous infections. Like for example, you might end up with herpes zoster, which you might better know as shingles. So what I'm trying to say is Rapamycin is not meant for everyone. I could only cover the first half of what Bryan shared. He then talks about the tools and equipments which he uses in the latter half of the video, which is something worth exploring as well. I did not cover it in this video because it would become a very lengthy one, and I know you cannot watch me blabber all day. So what is my overall take on Bryan's anti-aging skincare routine in terms of what he is taking orally and applying over his skin is, well, I think he can do slightly better. Now he has his own reasons, and rightfully so, for taking isotretinoin over applying tretinoin. But what I would suggest, if I had to summarize and propose a very simple but effective anti-aging skincare routine to begin with, it would be cleanse well, especially in the evening if you're being subjected to a lot of pollution or if you're applying makeup. Moisturize well. It doesn't have to be something very fancy, but something basic with ingredients like ceramide or niacinamide or tallow or anything that will help you build and maintain a healthy skin barrier, along with taking care of any other things that you are worried about, like dyspigmentation. Apply your sunscreen and sun protect yourself well. It is a must. Add retinol to your skin routine gradually to begin with, and work your way up to a retinoic acid when you feel comfortable. And eat a diet that is rich in good fats, healthy proteins, and a wide array of micronutrients, even supplementing with good ones if required. In a previous video, I had actually shared which are the basic anti-aging or healthy aging supplements that you should begin with if you're starting on this journey. Remember, healthy aging and healthy skincare work best when you work from the inside out as well. Tune into your body, work with your practitioner, and try to see what works best for you and not what you see working for someone. If you found the video helpful, please show your love by giving it a thumbs up and sharing it with your friends and family. And in case you still haven't, make sure you subscribe to the channel so that you don't miss out on any new video that gets released. My respect to Bryan and his team for all the efforts and transparency in what they do. I'm honestly intrigued to see where this goes. Until then, continue to glow, thrive, and shine. As always, take care. I'll see you soon.
But keep your head up, Charlie. We were made for this life, yeah. Wait to see how we rise up. We've been there for too long, waiting for a come up. Better days around the corner. All the pain made us stronger.